Good afternoon, everybody. Thank you all for joining us. My name is Alex Padilla, proud to serve as the senior senator for our home state of California, joined by some tremendous leaders in this important fight to protect access to health care and quality of health care. You'll be hearing today from Ms. Jessica Altman, the Executive Director of Covered California. You'll be hearing from Jody Hicks, CEO and President of Planned Parenthood Affiliates of California. You'll be hearing from Veronica Alvarado, small business owner and a Covered California member. You'll be hearing from my colleague in public service, Assembly member Mark Gonzalez, in whose district we are standing here today, and we will strive to have time for a few questions at the end of all of our prepared remarks. But let me thank everybody for joining me here today and jump right into it. Now, we're here today because millions of Californians are near a breaking point. You know, when folks spend time figuring out how to pay the bills every month, they see the cost of the groceries rising. They see energy bills on the rise as well. And among other bills that are continuing to go up are healthcare costs. But despite it all, recognizing that working families across the country, not just here in California, are finding themselves increasingly in dire straits, President Trump and Republicans in Congress seem to prefer to shut the government down than to work with Democrats to address this challenge of increasing health care costs. And it's not just what may or may not happen next week. Let's begin with the impact of what they call the One Big Beautiful Bill, which is anything but beautiful. That bill ripped away health care for millions of people who rely on Medicaid. And why did they do that? To underwrite tax breaks for the most wealthy in America. That in and of itself was wrong. But now, Republicans are refusing to extend life-saving tax credits to keep health care affordable. And I'm speaking about all the people who receive their coverage through Covered California. If Congress doesn't act, then Americans are staring down the largest health care increases in 15 years. 15 million Americans at risk of losing their health insurance. And for another 20 million Americans, it would mean a spike in their premiums. And that alone could increase the cost of health insurance by on average 75%. So imagine that, nearly doubling your cost of health care. Now, here in California alone, the stakes are high. More than 1.7 million people facing skyrocketing premiums. Rural hospitals and nursing homes at risk of closing. Californians making less than $62,000 a year could be forced to pay another $100 or $200 a month more in premiums. That's a lot of money. And so today we're here to uplift the voices of Californians who would be hurt should Republicans choose to shut down the government, because it is their choice. Either shut the government down or work with us to address these health care concerns.